The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Atcha. Dr. Atcha, welcome to the program.
Thank you, Randy. Pleasure being here.
All right. Now, before we get into today's topic, tell me a little bit about your practice. We invited you to talk about dental implants.
Sure.
Brought a lot of photos, by the way. Some of these are pretty gruesome photos, by the way. But and you brought models. What are the different types of procedures you do at your office?
Sure. Randy, we have a very unique practice. Actually, we have a unique practice in the sense that, I have a general practice. I have a large general practice with 3 doctors, and we do all kinds of procedures.
Where in Chicago are you, by the way?
I am in D.I.C.O, Indiana, which is 20 minutes from downtown Chicago, but still considered a suburb of Chicago.
All right, all right.
We see patients from all walks of life, from children to to teenagers to adults to seniors. We do root canals, we do crowns, we do bridges, but my passion, my focus in the practice is dental implants.
You like dental implants. I
love dental implants.
We've talked a lot off camera, things like that. Then your training went to LVI, trained under, I guess, this Paulo guy, whoever he is, like the godfather of dental implants.
Yes.
So you've put a lot of training into dental implants. So what's changed? Why is it that what used to take like 9 months to get dental implants now can be a few visits? I mean, what's different? What's changed?
Sure. A lot has changed, Randy. What's changed is the way we do implant dentistry. To me, implant dentistry is the best thing that happened to dentistry.
Really?
It reconnects people to something that they've lost. Okay.
All right.
And what they've lost is a tooth. Okay. A lot of times, we take we take our eyesight, our hearing, and not only our hearing, we take our teeth for granted until they're lost, and they're really missed sorely. When I get patients from either one tooth missing, a few teeth missing, or all their teeth missing, their common complaint is that they can't eat, they can't smile, they can't chew. So yes, dental implants do reconnect people with something that they've lost.
Now, you've had extensive training.
Yes.
You say with dental implants.
Yes.
Tell me about it.
Randy, I've restored implants when I got out of dental school, but my real training started in the last 5 to 7 years, where I've sought the best mentors in the field of implant dentistry.
Okay. You even went out of the country to learn this?
I went out of the country too. I went all over the world. Absolutely. I went all over the world to learn what I wanted to learn so I can bring it back to my patients and enhance their quality of life.
Okay, so you do the surgical part of dental implants and you put the tooth on top, but that's not how it's normally done. Is that right?
That's correct. The traditional model is where a patient either goes to a periodontist or an oral surgeon and gets their implant placed, and then they have to drive all the way across town to their general dentist or the prosthodontist to have a tooth put on. There's nothing wrong with that concept, but I realized that it created a lot of confusion for the patients. Different fees for the dentist, different fees for the surgeon. Patients want convenience, and patient wants it all in one facility.
Is it true they still don't like going to the dentist, right?
They don't. Patients don't like going to the dentist.
Do you hear that, by the way?
I hear it every day.
What do they say to you?
Say, Doc, nothing personal, but I don't want to be here.
Really?
I hear it all the time. But we make a joke out of it. I say, you know what? I don't like patients.
You do say that's funny.
Yeah,
okay.
But it's funny. So we break the ice. But the patients like patients like this model better is because they don't have to go all over town for their care. They can have.
You even have a CT scanner.
Right. I invested in a CT scanner because it allows me. Because when we do so many dental implants, it's better whether you do one tooth, few teeth, or all teeth missing. It's better because I know exactly in 3-dimensional where my patient's anatomy is like. I know where the nerves are. I know where the sinuses are, and I don't have to play guessing game like I did with the conventional Panorac.
So how is it though that what used to take you 9 months now can be done, in a few visits, as far as dental implants?
Sure. Well, one is definitely with imaging. With 3D imaging, we know exactly what we see in patient's mouth. It's a one-to-one. What we see in patient's mouth is what we see on a scan. So it guides our implant placement very, very accurately. We know where the vital anatomy, the sinuses, the nerves are. So there's no guessing game.
Okay.
Secondly, with different methods, we are able to different methods and different types of implant design. Implant design have evolved so that way we are, what used to be that we have to wait for the bone to heal and then place teeth on. Now we can take out a tooth, place implants, pack a little bone around it, and put a tooth on or teeth on immediately.
And they can eat?
And they can
Right
eat
away?
soft. Absolutely, they can eat softer foods. There's some restrictions, but the best part about it is that in these days, Randy, everybody wants immediate gratification.
Okay.
So immediate placement of dental implants is a very advanced but a very revolutionary concept that when patients can walk in our office with a bad tooth or a missing tooth, but patients can walk out with an implant or even a temporary tooth, and it really people like that.
Okay.
People
Okay,
don't like to
good.
wait these days.
Good. Now let's talk a little bit about your photos. Okay, you say that you're changing people's lives.
Yes.
You say, okay, we're not going to bring you these photos, and I'll show you. You be the judge.
Okay.
Okay. So, what do you have here?
Let me show you this patient that we had that came to our office.
Okay.
She's 92 years old.
Wow, 92. Okay.
Yeah, she's 92 years old. She came to us, and her chief complaint was that, Doctor, I do not want to die with teeth and sitting next to me in a glass. And
She said that to you?
She absolutely. She said that during the consultation. And I asked her, I probed a little bit into it, said, what do you mean by that? And she said that, I know, I've been to dentists, I've been told that my teeth are bad, they need to be removed and have dentures. And I don't want dentures. And everywhere that I've been to, they say, you're too old for dental implants. You're too old and you're too medically compromised for dental implants. They've been discouraged. I've been talked out of having dental implants. But
okay.
So with her, what we did, we had to remove all her teeth, top and bottom. Her options were, we could have just given her 2 implants on the bottom, and the
So
the
2
teeth,
dental implants on the bottom.
Yeah, 2 dental implants on them where they could come in and come. The teeth would come in and come out.
Snap in, snap out.
Snap in, snap
All
out.
right.
She could have had 3 to 4 on the top, but that's not what she wanted. She wanted fixed teeth. She said she did not want anything that she has to take out at night. She doesn't
Okay,
want anything
okay.
that she has to clean it. So she said, am I a candidate for my age for fixed implant teeth? So we did our evaluation and workup, and after discussing with her,
I'm surprised she's healthy enough, by the way, at 92 to go through this.
She's fairly healthy, but she's had few cardiac issues. But we know, as with every patient, we consult with the physician, making sure that she's clearance for any kind of surgery.
Okay, good.
And we got the clearance, and we removed all her upper and lower teeth, and on her upper arch, she had 6 implants placed. And the full arch of teeth, okay, 12 teeth, okay.
Okay.
She had on the lower jaw 4 implants placed on the day the teeth came out, and full arch of lower teeth. And
So it's like having her teeth back.
it's like having her teeth back. I want you to take a look at before and after. Okay?
All right.
There's a day and a night difference.
Yeah, that's for sure.
She's like, there are a lot of people like her that are walking around like that with infected teeth and bad decayed teeth.
But they don't smile.
But they don't smile. They don't smile. They don't eat. They're socially withdrawn. But now look at her now. Look at her teeth before. They look, look at the difference now and what it was before. She's like this. There are a lot of people like that. She put it off. She's in her 90s now. She could have had this done when she was in her 60s or 70s. But
Okay, good point.
But she realized that, you know what, after having my teeth done, I'm actually going to have a better quality of life. I will live longer. And that's exactly what she
Is this one of those things where people, when they get their dental implants, okay, so the denture wear comes in, 2, 4, 6 implants, give them something fixed in their mouth. Do they say, I should have done this years ago?
They absolutely, Randy. They said that all the time. They said, you know what, doctor, I wish I would have done this a long time ago. Had I been younger or much, had I been given better options, I would have done this long, or had I known before.
So if it's as good as you say it is, okay, because anticipating this interview, go on the internet, 25 to 32 million people are wearing dentures. Thousands, I guess tens of thousands in Chicago, you think?
Tens of thousands.
Okay, if it's as good as you say it is, why aren't they all doing it? What's your take?
The reason why they're not doing it is because they're wearing dentures. They thought that's the only option that they have.
Okay.
Now that they know that there's better options out there, they feel that it might be painful. They feel that they may not be candidate because of their age, but
they don't go to the dentist. I mean, a denture wear doesn't go to the dentist.
Absolutely, denture wear does not go to the dentist because they're like, I don't have any teeth. What do I need to go to the dentist for? But
what about age? My mother, 74 years old. She says, Randy, I'm too old for dental implants. She's been but I should tell you this. She's been in dentures. She's 74. She's been in dentures since she was 28.
Okay.
Is she too old? If she's healthy?
Absolutely not, Randy. Just like this patient, that she's in her 90s.
Okay.
If age is never a determining factor. If somebody is in his or her 70s, it's a great age. There's no age.
Really?
To have. Absolutely.
But it seems very painful. So the bone doesn't have pain. So that's why there's not a whole lot of pain.
The bone doesn't have nerve ending, but Randy, you have to remember that before we do any procedure on a patient, whether it's a single tooth or a full arch, we take into account making sure patients comfortable. Patients comfortable through either sedation, local anesthetic, and when it's said and done, most patients feel like they have had nothing done, and there's
and the next day, is it true that some of them just take ibuprofen or Motrin or whatever?
That's very true. Some of them take some anti-inflammatory, ibuprofen, Advil, maybe prescription medication if needed, but
Okay.
majority of them just function just like.
You brought models. Let's start there. Let's talk about the different options
Okay.
that denture wearers have, because you say with as little as 2 dental implants make a huge difference in a person's life.
Absolutely. Let me show you. This is actually the standard of care now. Okay, the standard of care is when we know what happens when we make a denture. Okay, when we make especially a lower denture, that denture is just going to wiggle and wobble, and it's just going to float all over. Okay.
Okay.
And the food's constantly going to get underneath there. They're constantly when they laugh, when they smile, it's just going to come up. So with dental implants, the absolute bare minimum is to place 2 implants in front part of the jaw, where it's mostly the most available bone, and we can take either the old patient's existing denture, okay, or we can make a new one, and we can literally secure it to these implants.
Is this an actual model?
This is an actual model, absolutely.
So this is the way it'll feel.
Yes.
Okay, so and they could eat with this.
They can eat with this.
2 implants. I mean, is this dramatically better than adhesive?
It is true. It is tremendously better than adhesive, because a few things on adhesive that you have to remember that they have to use a lot of it. Okay. Secondly, there are studies that have shown that high amount of adhesive causes some sort of neurological toxicity.
Interesting. Okay.
There's studies on that. So
okay, so 2 dental implants. Do you think people count their teeth and think, I can't afford dental implants? So you don't need an implant for every tooth.
That's very true. That is very true. Traditionally we did implant for every tooth, and here's the thing with that is A, it becomes very costly for the patients. B, we don't need an implant for every tooth, because think about it, it's creating more trauma to their bone. Okay. Lastly, with the new and revolutionized technology, with the new advanced concepts, we can restore somebody's upper jaw, a lower jaw, with minimum 4 implants. Sometimes we'll do 6 if needed, but minimum.
So 4 implants to give them something that doesn't come in.
4, absolutely.
And come out.
4 implants.
And tell me the time frame. We're going to take a quick break. But
Sure.
Somebody watching this, okay, they're a denture wearer, right?
Yes.
And 60s, 70s, you say, even 90s. If they're a candidate and everything goes right, they come in, how soon could they get a set of teeth?
I would say in 4 to 6 weeks after we do all the preliminary workup and the planning, because all of it is.
Okay, so about a month and a half from
Absolutely.
now, they could have teeth that they could chew.
Absolutely.
Now, when I see, and we're going to take a break, but I've seen. I think when I researched you online, I see people biting out of apples.
Yes.
Right after surgery or
right after surgery. Yes.
You don't recommend that, but they could. I mean, that's how strong it is.
That's with the first 2 days. That's when the integration to the bone is the strongest. So when they're done with their surgery, we actually give them an apple to eat.
They could. You don't do that every time, right?
No, not all the time. But
You've done it. You've actually done it.
We've done it.
So they're strong. Okay, we're going to take a quick break. We come back. More about the options for the denture. Sure. You're watching the Wellness Hour, leader in medical news and information. It's all about dental implants. We'll be right back.
I used to wear a upper partial, and I had some missing teeth on this side over here, my upper right side.
And it started because I had a full upper denture.
When I came into Dr. Atcha, I was really unhappy with my teeth.
I had no pain. I had nothing afterwards, nor prior to all the times that I've been here with the implants. Nothing.
Don't wait to take care of work that is needed in your mouth.
I would recommend Dr. Atcha and also all of his workers to anybody.
I really lucked out when I found him.
I would recommend Dr. Atcha to my friends, to my family, to strangers, to anyone that needs special care with their teeth.
I just think he's a very exceptional dentist.
This is, like I said, these dental implants are the second best thing God ever gave a person.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implants. With us, we have an expert on the topic, Dr. Atcha. Okay, so we've talked about, for the denture wear, 2 dental implants, and you put them right here. Something snaps in, snaps out.
Yes.
Big advantage over adhesive. Okay. but you don't like those. What do you mean by that?
Well,
Your first preference. What do you mean by that? 2 dental implants.
You know what, Randy? If we can give somebody's natural teeth back, if we can restore an arch with fixed teeth, with putting 2 or maybe 3 more implants, why not? You know.
Okay, good point.
If I can add 2 more, and if I can add 2 more implants in the most available part of the bone, and I can give them fixed, non-removable implant teeth, that is absolutely, in the long run, a much better option for that patient, because A, they're never going to have to take their teeth off. They can chew harder foods. It will get their biting function up to 80 to 90%.
Does it feel like their own teeth? I mean, they probably forget they even have them after a while.
Absolutely, it looks and feel like natural teeth, because when patients get implants and teeth afterwards, I mean, they forgot what chewing was like. They forgot what eating was like.
Is that right?
Absolutely, and we're able to, and they get that back, and it's very, very exciting for them.
Okay, so you have more models. Okay, so 2 implants. What's the next level up?
The next level up is what's called the all-on-4. All the teeth on 4 implants. Okay, the all-on-4 is a very revolutionized, very cutting-edge, very advanced technique that allows us to restore somebody's arch, full arch, lower, upper, lower arch, with 4 dental implants in.
Let me take a look at this.
Sure.
Okay, so 2 in the front and then 2 on the sides, and they're angled.
But the back ones are angled. The back ones are angled to avoid the sinuses on the top. Back ones are angled on the bottom to avoid the nerves. Okay, what that does is it allows us to put rock solid teeth on those implants on the day of the surgery, and then eventually final teeth 3 months later.
So it's a full arch of teeth.
It's a full arch of teeth.
Okay, but how do they clean them? I mean, what's the care?
The care on this is very, very, very simple. We give them a water pick. Okay, we use the water pick to clean on where it's fitted by the gums, and all they do is they brush. They brush with a regular toothpaste and a regular toothbrush. The maintenance on this is very simple. This is called a fixed hybrid. Okay, the fixed hybrid is attached to those teeth, so you really don't need to have a crown or an implant for every tooth. You know, that's tremendously costly. It's not minimally invasive, and it takes a long time to do that approach. I mean, and if patients want a traditional approach, we still do it. But I explain to the patients that everybody wants immediate gratification these days.
All right.
People want teeth sooner rather than later, and people want minimally invasive technique rather than maximally invasive technique. You know, that's why the all-on-4 came. And a lot of times, patients that you know, if we need to do implants in the back part of the jaw, we have to do extensive building back the sinuses with bone grafting. You know, we have to build.
Is that behind you, by the way, now?
You know,
with the new technology.
In my practice, I would say 99% of my full total rehabilitation is without doing any bone grafting.
Any grafting. Now, what are these guides for the sake of time? Because you say you do the surgery on a computer first.
That is very true.
What does that mean?
If somebody is missing all their teeth, if a denture sufferer comes to my office who's chronically is tired of wearing a denture, okay, and after taking a 3D scan, I realize that they're a good candidate, I can do what's called virtual-based surgery, where through my planning software and through the data from my CT scan, I can place my virtual surgery. That data gets transmitted to another party where we actually have a guide, prefabricated surgical guide
that's just place the implants
that custom fits the patient's jaw.
Interesting.
And it precisely allows us to place implants where they're supposed to be, dictated by the guide. The best part about this, Randy, it's minimally invasive. Okay. Flapless. I never have to use a scalpel to cut anybody's open.
That's why there's less downtime.
That's why there's less downtime, and no stitches. No stitches, very little bleeding. And to top it off, I can put the teeth, I can have the teeth ready. The teeth can go on the same day of the surgery. If somebody comes to my office with a full arch of missing teeth, but from the time they start, the time I finish, I can put teeth on in 15 minutes.
In about 15 minutes?
15 minutes.
Okay, and that gives them something fixed, the denture wear. Now the upper. But I thought the upper for denture wearers, they're fine because you have the suction.
Yes.
Tell me about that. I mean, why would you want to do that? Why would you want to get dental implants for the upper?
Well, if you look at an upper denture, the upper denture, yes, it does stay on better than the lower denture because you have a palate. Okay, you have between hard and soft palate. There's a demarcation that allows us to keep the denture on. But think about it. Where does most of your tasting of the food occurs? On the palate. Okay. A lot of people are gaggers. Okay. When we make denture, a lot of denture wearers don't like to wear them because it makes them gag. Okay. Try to take.
But they get used to it, though. I mean, they get used to it.
They get used to it, but a lot of denture wearers, they don't. Here's what I say: denture wearers are either they say they're lucky or they lie.
Okay.
That's because nobody is happy with dentures.
Okay, good point. Good
So
point.
if you're looking at upper denture, the upper denture doesn't serve any purpose. It just sits on top of the gums. It covers your palate. You can't taste your food. It makes you gag.
Okay, so what you're able to do, how many implants do you need to give them something that's fixed?
On the upper.
On the upper.
On the upper, most patients I can give 4 only. Like I said, 2 implants tilted in the back part of the jaw, 2 in the front. If somebody has thicker bone, somebody has a wider arch, then we'll place 6. Okay?
6 implants.
At minimum 4, so sometimes 6. Okay.
And they could have something fixed.
They can have something fixed immediately.
Okay, and they could chew them. They could chew whatever. Broccoli, carrots.
They can chew once after healing phase has occurred. You know, what we do is we give them trial teeth on the day of the surgery. The trial teeth are for chewing, you know, softer foods.
So they're not without teeth.
They're never without teeth. Okay. And after healing occurs and bone forms around them in 3 to 6 months, then their final teeth, they can chew whatever they want.
Okay, so they're never without teeth. And we're going to take another quick break. More about the denture wearers, and I want you to take me through the process. What the diagnosis is like on day 1. Okay, and show some more of these photos. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about dental implants. No more dentures. If you have a loose-fitting denture or you've been told your teeth have to go, you may want to consider dental implants. With us, we have Dr. Atcha. Okay, so you brought more photos. What else are we looking at here?
Randy, look at this. Look at this patient here.
Oh,
look,
my goodness.
Yeah, if you look at her condition, she has a severe gum and bone infection. She's severe gum and bone infection.
Is that rare, by the way? I mean, that's got to be rare.
Actually, it's not that rare. You don't see it because these people just don't smile. They hide their smile all the time.
Okay.
She had gone to her dentist, and her dentist had given the option of removing those teeth because those teeth are bad, and wear dentures. And here's another patient that did not want dentures.
How long does she have a smile like this, by the way?
She's been like this for about 15 years. Oh. She's avoided going to the dentist for 15 years because she had a few bad experiences.
Interesting.
She couldn't get. She's actually a very high fear patient. Okay. She's a very high fear patient. She'd had bad experiences. She couldn't get numb. She'd had teeth pulled and had root canals done, and she just wasn't. After that, it just put her off.
So what did you do for her?
Well, I knew and she knew her teeth had to go, so we removed her upper and lower teeth all in one appointment. She had 6 dental implants on the top. She had 4 dental implants on the bottom, and we were able to give her fixed, solid, non-removable implant teeth, and you can see what she looks like now. Now, look at her smile. She is so happy. She's so happy that she's smiling. She's smiling like she never used to before. Her teeth don't look like the way it was since she was 16 years old. In fact, they probably look better than when she was 16.
Interesting. So she probably says, I should have done this years ago.
She's another patient that said, I should have done this many, many years ago. And what also she says that after she got done with her final teeth, first question she asked me, can I have beef jerky?
Is that right?
Absolutely. I said, absolutely. Go ahead and really enjoy yourself. Here's another patient. He is a denture wearer for many, many years, for about 15, 20 years.
Those are dentures?
Yeah, those are dentures.
Okay.
He used to hold his dentures with bread. Okay, never heard of.
This is the bread guy, you said.
This is the bread guy. People use glue, people use adhesive, but he used to use, because he's a bread maker, so he used to use bread to hold his denture.
Okay.
He said that's what would hold the dentures in. He had a broken down denture. It was ill-fitting, and he wants something that did not want to come out in and out of his mouth. He wanted something fixed. Let's look at the after. Look how natural and nice it looks. He looks amazing. I mean, it's custom fitted to his facial profile, his complexion, everything. And I with every patient, I do a very, very thorough smile design analysis to make sure that once it's said and done, they have a beautiful, nice looking
Is it
teeth.
emotional when a guy goes from that older denture, he sees himself for the first time in the mirror?
Very emotional.
You see tears?
Very emotional. I could just hear the enthusiasm in him when he every time he comes in, he comes for his regular checkup, and there's patients sitting in the waiting room, and he just talks about how happy he is.
Okay. All right. What are we looking at there?
Go to the next one. This is actually a very, very, very interesting case. This is a 30-year-old. This is a 30-year-old who has been wearing dentures for about 10 years. Okay. A 30-year-old, never heard of a 30-year-old wearing dentures. Okay, came to us, wanted to lose his dentures. Randy, this is the day of the surgery.
Okay.
He had no teeth left, so we were able to put four implants on the top, 4 implants on the bottom, and this is exactly how we did it. We did his upper and lower surgery with the guided, minimally invasive dental implant surgery. He left with fixed set of teeth on that day, and the reason why the face is a little crooked because he's numb, and he's numb. Okay. He's numb, and
he doesn't look like he's used to smiling yet.
And he's not used to smiling. He just kind of covered his face all the time. Now, here's a young man who who was wanting to go to law school for a long time, but his self-esteem was so down that he would never smile. The dentures would fall out. Now he's got into a law school. He's much happier, and he's more social as well. He's more social. And when I talk to him and his mom comes in with tears that I can't. My son's life has changed. You know, he's much more social. He's much more out there. He's more outgoing, and he got into law school, and he's much more confident now.
So, final message. We're out of time. Somebody watching this, they're denture wearer. Maybe they're skeptical. Okay, what do you say to them?
I say that, you know what, give us a call. At least come in for the consultation. You know, we can actually we can do it just two implants in the front part of the jaw, and they don't have to wear a sticky. They don't have to use adhesive. They don't have to use the glue, and they can lose the adhesive, and at least secure the denture for its somewhat of chewing comfort. Okay.
Okay.
That's the bare minimum. Okay. Age is not a factor.
So it starts with a consult. Free consultation?
Yes, the consultation is complimentary. It's no charge. And also, what we do is we take a complimentary 3D CT scan on the patient when they come in. So at the time, I can show them if they're a good candidate, where their good jawbone is, what we can do for them, and I give them options. You know?
All right. So I know you do cosmetic dentistry. Is the denture wearer that gets dental implants the happiest group of patients in all dentistry?
Yes, they are, because once they're done with their implant care, they can chew, they can eat, they can smile, and they can regain their quality of life back.
All right, I want to thank you for coming to the show. Good stuff.
Thank you.
Excellent stuff. And all of these photos are on the website, and you've got all the patient testimonials as well on your website. So thanks again for coming in.
Thank you, Randy.
You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or online, we'll give you a copy. You can even put this interview on your website. Okay, and it's also on our website. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.